Well, hello, and welcome to my Thinking Like a Nurse Part 2. So, the next key pens-up point I'd like to review when you're thinking like a nurse, especially on nursing exams, is to think about your priorities if you're stuck between two answer choices. So, the first thing is you want to prioritize your care. You want to save the patient's life. So, if there are two options, you only have one. In the real world, of course, you will be able to multitask. You will have team members that will help you to delegate to. But think you can only do one thing and you have to go home for the day. What will that be? And a lot of times you can choose, I need to choose one to save my patient's life, or think about Maslow's hierarchy of needs. Airway, breathing, circulation, you have to take care of those things before you can take care of patients' other needs. So if two answer choices, one is reassure the client, and B is monitor their heart rhythm. If monitor their heart rhythm makes sense for that question, then you would want to choose that answer choice. And I put underneath their Maslow ABCs to remember things like that cardiac monitoring. Many times patients' electrolytes will be off balance. Some medications can cause an increase in potassium. We call that hyperkalemia. And remember what that does? What kind of side effects does that cause? Well, serious side effects. It can affect the heart and cause very dangerous arrhythmias or electro abnormalities in the heart. So we would want to make sure that we are prioritizing correctly. Again, remember the nursing process. You always want to assess your client before you are going to do anything for them. If you have enough assessment information in the stem of the question, then you may not need to pick an assessment answer choice. A lot of these examples will become more clear the more questions you do and the more exams that you take. That's why I really like the Wolters Kluwer Prep View questions, because it gets you ready for exams. Another key pens-up point is you want to eliminate incorrect answer choices before you pick a correct answer choice. A lot of students will get questions wrong because they go to that answer choice that sounds good, that looks good, that sounds like something they remember somewhere in the text. Don't do that. You want to eliminate incorrect answer choices, and then you'll come up with the correct answer choice. Many times you may not even know why the correct answer is correct, but if you can eliminate the incorrect ones, then you have went about that the correct way. If you've ever played that game Sudoku, you know that you can get to the right answer by eliminating incorrect answer choices. Same thing, critical reasoning skills apply. Next is don't ask why questions. Why don't we ask why questions? Well, think about it. You want to think about if this were a situation where you were a nurse and a patient came in and had a fever, let's say for 3 days, and they said, I didn't take any medications, or I didn't think it was any big deal, and you said, well, why did you wait 3 days to come in? How might the patient react? Well, they would be defensive, right? Oh, did I do something wrong? Patients want to please their nurses, and they want to do the right thing. So a lot of times they'll say things that aren't true just because they're embarrassed, or they feel bad, or they want to make sure that you are feeling like they are listening to you as the nurse. Another tip is don't ask yes/no questions. This really limits the conversation that you have. And so tips of therapeutic communication, you want to ask open-ended questions. There's only one instance that we suggest asking a yes/no question. Do you know what that might be? You're right. It's if a patient is having depression, suicidal ideations, you want to come right out and ask them, are you thinking about hurting yourself? Because if they are, chances are they will say yes, because it's a cry for help. Next, document findings. If you see an answer choice on an exam that says document findings, this is a do nothing answer choice. Document findings means you think everything is fine and you have time to go to the nurse's station and document your findings. Sometimes this can be a correct answer choice if everything in the stem of the question looks good. If you're not worried about your client, then that is what that answer choice is saying, that you think that everything is fine and you have time to document your findings. because you will always document your findings as a nurse. Charting is one of the biggest things that we do that takes up time. An answer choice that says call the provider or physician is a pass the buck answer choice, meaning whatever other answer choices are there are either not appropriate or they are outside the scope of your practice. So let's say a patient has a cast on and the toes are blue, and they say, what would you do? Call the physician would be a very appropriate answer choice, and would be the correct answer choice for that, because that is outside of your scope as an RN, is to take that cast off. So you need to notify that physician immediately that the patient has compromised circulation and that cast needs to come off. If there is another answer choice that is within your scope of practice that is appropriate for the answer choice, you would want to pick that answer choice. Don't pass the buck to someone else. The next is go with your gut. If you have an answer choice that you really think, I think this is the right answer choice, many times you will be correct. Sometimes students go from correct answer choices to incorrect answer choices and make that mistake. If you're one of those students, then maybe you don't want to go with your initial gut. But many times your initial gut reaction is going to be a good choice. So think about that during nursing exams. Focus on the patient. A lot of times you'll have answer choices that will focus on the nurse. Say if the patient is asking, well, what would you do in this situation? And then an answer choice says the nurse, well, I would recommend doing this, or my sister had this and I did this. You do not want to do that. You don't offer advice. You focus on the patient at all times. And that's it. So hopefully these Thinking Like a Nurse key pens up tips have helped you prepare for your first exam. Take care.